welcome those type of conversations. So I am going to turn it over to Barb, and Barb, I'm going to pull up your slide deck for you. I thought that might be a little easier.
I'm excited to be here. It's been quite a wild ride, hasn't it? We've been going on, it's going to be like 2 years now. I remember I was in Hawaii like 2 years ago, Thomas, and my girlfriend and I were there, and we were leaving from the airport in Kona, and I saw my first mask, and I had just heard about COVID. It was like the 3rd week of January. And I was like, oh, that's interesting. Somebody's wearing a mask, and little did we know that everybody in airports would be wearing a mask very soon, and it would be hard to get to Hawaii. So I'm glad you're suffering there in your quarantine. That was so, but I'm going to go over some slides. We showed these on the School Health Echo on Monday, and I added just a couple extras to that. So if those of you that do get on that, it's awesome presentation, 3 o'clock on Mondays, 3 to 4. It is recorded, so you can watch it later in case you're watching kids during this time, which you probably are. Okay, next slide. So you had some questions about Omicron. Everybody does. So it is actually the most prevalent variant right now. It's estimated to be about 95% nationally. Especially in Alaska too. We've been seeing an increase of cases. Next slide. So this shows our daily rate, and this is a little bit behind. It was January 7th, I think. Anyway, so as you can see, that's really going up high with the Omicron variant. The good news is it doesn't seem to be quite as serious with hospitalizations and deaths as the Delta variant was. Next. So this is how our cases in Alaska are looking, and it is similar to what's happening nationwide. So there's a big spike, and if we're going to be like South Africa was or New York is, there was a spike downward. So that is my hope, that we've increased a lot, but hopefully in the next couple of weeks we're going to start to see a decrease again. Next. So this is where we're at in Alaska right now. Our amount of people that are hospitalized is not as high as it had been, and the amount of people on ventilators right now is not as high, but we have just peaked the last 2 days at the highest case rates ever in the state. So next slide. How are children doing with COVID right now? So this is children and COVID in the US in the past week or so. So as you can see, the rates are going up for adults, and they're also going up for children. The children is the darker blue underneath there. Next. So children in the US, the cases as you see, have gone up quite dramatically. Omicron is affecting the children more than the other variants did. Next. And I might add, it's actually helping vaccination rates of children around the country. We're seeing that more parents are choosing to get their younger children, the 5 to 11-year-olds, vaccinated. We've had a pretty good rate of those that are teenagers. But if you look at this in the dark blue, 68 of our residents in Alaska, 68.2%, have received at least 1 dose of a vaccination for COVID. And 60% have completed their primary series, and 23% have received a booster. Now that could be that some are in the waiting period, or maybe some have chosen not to get a booster, but boosters are really effective against the Omicron. So if you look at the bottom of the slide, the residents 5 to 11 that received at least 1 dose, we're only at 22%. Now I'm hoping that's going to be rising if we're following a national trend that more parents are going to get those younger kids vaccinated. Vaccination status who've completed it in that age group is 16.5%. And you can go look on our dashboard and see if the area that you're in, how the kids are doing. Residents that are teenagers 12 to 18 are a high percentage here, 55.7, and there's 50% that have completed their vaccination status. And I want to say that we are considering any of our children under 18, if they've received at least 2 doses, that they're fully vaccinated, although they can receive a booster if they're at least 12. Next. So who should get a booster? So if you have had at least 5 months since your primary series that was just changed about a week ago and not 6 months, you can get another dose of Pfizer or Moderna. And if you are severely compromised child, then you can get a dose, a booster dose. Basically, you can get like a 3rd dose. So that's something that's available to our kids that are, very compromised. So they can get that after 28 days. And the US Food and Drug Administration has just recommended the Pfizer booster for those aged 12 to 15, so they can start getting boosted. Next. So do you qualify for a booster? I would highly recommend any of you that are working with children, if you have had at least 5 months since your primary series, to go ahead and get a booster. And the current recommendation isn't on here, is to get Pfizer or Moderna. We found that the Johnson & Johnson is not quite as effective as the other 2 are. Next slide. How effective is this vaccine against the Omicron? So this is a really important slide, Thomas, if you want to kind of point to the dark squares up there, that's Delta. How effective was Delta? And so we're looking at the time since vaccines. Now look at Omicron. So if you look at the bottom there, like the 4th over, it's only 35% or so, 37% effective with 2 doses after a period of time, after 24 or 25 the days. I'm trying to see if this, yeah, this is weeks. So what's happening is that these vaccines are not working as well against Omicron. But however, if you look at the last circle there on the far right, it is working if you get a booster. So that's why I would encourage all of you. It's looking about 75, 78% effectiveness if you have the booster after 5 months. Omicron versus Delta, as you can see, there's just a little comparison there. Okay, next slide. So things you should know: vaccines and booster shots are the best protective measure that we have right now. One of you asked how effective how are we doing with Omicron? Is it still worth it? Yes, absolute mitigation procedures are still worth it with Omicron. We do have monoclonal antibodies available. The ones that are working best against Omicron, we are in short supply nationwide and in Alaska. So if you are in a category of being more immunocompromised, maybe you have some chronic illnesses, if you become COVID positive, call your doctor and ask if you would be one that should get monoclonal antibodies. They've actually saved a lot of lives and kept people out of the hospital. And we do have some new antiviral drugs that need to be taken within 5 days, just like flu, just like influenza. You can have an antiviral drug for that, but you need to take it right away. And we are seeing more cases of influenza coming up this season compared to last year. So if you've tested positive for COVID and you're experiencing symptoms, talk to your healthcare provider and ask if there's any medication that you might be able to take. Next. So this is some really good guidelines for you to have and to just have it on your desktop there, to refer to. I've had calls around the state from different preschools and daycare centers, and they want to know what can they refer parents to. There has not been new guidelines yet for the preschool age under kindergarten, but we're waiting for that from CDC. So if you look, Thomas, if you want to click on the first one there, I don't know if that'll work from your computer. Actually, the second one maybe would be better. Yeah, the overview of isolation. So I just want to take you to this so you can see basically what is there. So this is a great bookmark that you can have to show your parents, refer to yourself if you don't have a copy of these slides. So this talks about like, what is isolation and who needs to isolate? And you can go down a little bit how long should a student or staff member with COVID isolate? So if you look at that, this is what you can greatly refer to. It answers a lot of questions and gives the current information. Okay, you can click out of that and we'll go back to the slide. So I would make sure that you have, you have those handy. That'll help you with, you will get questions from parents and they will question you. Okay, next slide. So let's talk about the difference between quarantine and isolation. I always remember that you think of I as illness, and that's one way that you can really keep these two apart. So if you're positive for COVID, you're ill. So that would mean isolate. You isolate when you're sick or you've been infected with the virus. Quarantine is if you were exposed and you need to stay away from others when you've been in close contact with someone. Next. So quarantine guidelines for those who are not up to date on COVID vaccines. That would mean if you were past 5 months since your primary series, your first and second, or if you just had the J&J, the 1 dose, or basically if you're not boosted. So you would fall in this category where you need to quarantine at home for at least 5 days. Stay home. You should wear a well-fitting mask if you must be around others, even in your home, and you should get tested right away. If you've had close contact with someone, at least 5 days after your last close contact, we encourage you to get tested. These are CDC guidelines, and most schools have adapted this. This is school guidelines. Not every school, you might be in a program that hasn't, or maybe you're in a private after-school program and your program has chosen not to adopt these. I've had some private schools that haven't, and they've stuck with the 10 days. But after quarantine, so you want to watch for symptoms until 10 days after you last had close contact with someone. If you develop symptoms, you need to isolate immediately and get tested and continue to stay home, okay? But if you have had 5 days at home, you have no symptoms, you don't have a fever, you can go back to work, go back to school with a well-fitting mask, but you must continue to wear that mask for 10 full days after you were first exposed. You should avoid travel, and we're also recommending that you don't do extracurricular activities, being around a lot of people out in the community. Next. This is a quarantine guideline for those who are up to date. So if you look at the left, that is if you were exposed to COVID-19 and are up to date, meaning that you've been boosted, or if you were a teenager, you're under 18 if you've had your 2 doses, or if you've had COVID-19 in the past 90 days. So Thomas, you're going to be good for 90 days now. So you don't have to quarantine again if you're exposed to someone. So you don't have to stay home unless you develop symptoms, but you should be wearing a mask this whole time. You should get tested even if you don't develop symptoms around day 5. So both of them we recommend if you're isolating, if you're positive, and if you're, well, actually, if you're not vaccinated or if you are vaccinated, you should still get tested around day 5. So you want to watch for symptoms for 10 days. And if you develop symptoms, you need to isolate immediately. But you want to continue to wear that well-fitting mask, the mask that feels good, fits good without any gaps around the sides for a full 10 days. And you should avoid travel again and being around people that are high risk. So how do you calculate that? So at the bottom, it says the day of your exposure is considered day 0. Say, today I got exposed to Thomas. He was positive. Tomorrow I start my day 1, and it's my first full day that I'm going to have to isolate or quarantine, sorry. And if I'm not vaccinated, I would need to stay home for those first 5 days. Next. Universal masking is still recommended. That was one of your questions. It continues to be one of the best mitigation efforts that we have in school and after school programs. The consistent use of correct face masks. We've had questions asked about what about lunchtime, and you do the best if you're giving snacks to kids to, they can have their masks off during the time they have snacks, and as soon as they're done, mask up again, because they're usually in closer proximity when they're eating rather than when they're playing and being outside. So it does reduce transmission a lot. We found last year that kids weren't even getting the common cold because almost every school was masked. And so there's a difference this year with some of the schools not masking universally. Next. So isolation guidelines, regardless of vaccination status. So if you do test positive for COVID-19 or you have symptoms, like you have symptoms and you're presumed that you have it, maybe you don't have access to a test. You want to stay home for at least 5 days and isolate from others in your home if you can, and wear a well-fitting mask, even in your home. That'll protect the others. Ending isolation if you've had symptoms. So end isolation after 5 full days. If you're fever-free for 24 hours without the use of, say, Tylenol or ibuprofen, and you can, if you did not have any symptoms. And if you were severely ill, you should continue to isolate for 10 days. So you want to talk to your doctor about that. And you want to continue to wear a mask for the time, day 6 through day 10. If you're not fully well, you should not be coming back to work. But CDC changed this to allow more people to get back into the workplace. And they found that there's about 31% of people are still positive after day 6. And it goes down to about 15% by day 8 or 9. And but wearing a well-fitting mask is really very protective, and that should stop the spread. We just have as you know, air travel has been affected. Schools are having a hard time staffing with their teachers. So this was something the CDC came out with. And they also found that there's not as many people that spread at the end of that period, the day 6 through 10. Next. Test to stay. Maybe you're in a school setting, your after school programs in a school, and maybe some of those students are in the test to stay program. And this is just something that CDC came out with, that the school can have those kiddos that normally would be quarantining at home be able to come to school, but they're testing on a regular basis. So it's recommended that they do a test at least twice during that first 5 to 7 days. And they can continue to come to school as long as they're not positive. And there's more information about that if you'd like that. Next. Where can you get a test? I think most of you by now probably have a good idea where you can get one in the community. We have been distributing the over-the-counter test. The warehouse has gotten more of those in. There is still somewhat of a short supply. Most of the schools around the state have been having some kind of testing, either contracting in or available in the school. Airport testing is going to be ending January 31st and transitioning to more community testing or the at-home antigen test. And the at-home antigen tests, some of you may have gotten them. The airport's been giving them out too. They're relying on parents to contact the schools or the after-school programs and let them know if their student was positive. And what I hear, that's been pretty effective. Next. Test kits are available. Schools can still order them. The over-the-counter tests, they can still be ordered. The K through 12, you can actually order them for your after-school programs too. We just got more of the Buy Next Now cards in, and those are a lot simpler to use. Everybody I've talked to that's done a lot of testing prefer those over the Care Start. It's just a little, doesn't take quite as much time to use. Next. So we're going to focus on Healthy You in 2022. And next slide. I'm actually kind of hopeful because what I see is the Omicron variant is kind of, what word do I want to use? It seems to be not as harsh, not as, it is more transmissible, but the common cold is actually a coronavirus. And so I'm seeing that these variants hopefully will start to be less and less causing less death, causing less hospitalizations, and people will not have as many symptoms as they did with the first couple ones. So these are some of the questions that you ask. And I'm going to have, how many do we have on here, Thomas? How many people? I'm going to let people unmute and see if you can answer these, because I answered all these in my presentation. Okay, so how long should a student or staff quarantine if they're close contact? So we want to answer that?
You can also put it in the chat box.
Okay, so somebody want to be brave? Okay, so how long should they quarantine? 5 days, correct, 5 days. You heard well, okay. So if they are vaccinated, they actually fully vaccinated an adult with a booster, they actually don't even have to quarantine. But if they're not fully vaccinated, then they need to quarantine at home for 5 days. Okay, how long should students or staff quarantine if they're positive for COVID? And they don't have a fever. How long would that quarantine be? Anybody want to answer that one? Do we have any new answers? I can't see. That's going to be 5 days again. So 5 days from the positive test, correct, Courtney? So say you get exposed or you test positive is your day 0. Your day 1 starts the next day. So counting, say you were had a positive test on Sunday, then you quarantine Monday, Tuesday, Wednesday, Thursday, Friday. You could go out in public with a mask on. You guys have been listening. Okay, if someone tested positive for COVID less than 3 months ago, are they considered in the same category as vaccinated? What do you think? Yes, they are. So they would be in that same category. They could come to school, come to work. Correct. How long are you immune after having COVID? The latest that we know is what? How long are you considered? It's kind of like the same question, correct? 3 months, 90 days, correct. You guys listen, that's awesome. Okay, with how contentious Omicron is, are masking and distancing still important? Absolutely, it's actually even more important because it's being transmitted between 1.5 and 2 days. And wearing CDC is really recommending really protective masks, especially when you fly, like if you have access to the KN95, so the 95, when you're in places where you're in high transmission areas. So absolutely, it's still important. Okay, what questions do we have? That's it for the slides, Thomas. Thank you so much for doing that. What other questions haven't I answered?
I have a question. This is Jessica down in Juneau. Can you hear me?
Yes.
Oh, okay, great. So I got 2 young kiddos. We're all vaxxed and boosted, and they had a close contact who developed COVID, teenage contact. Anyway, so that means that I have a 14-year-old who got 3 tests in a week because of anyways, got a test based on the first one, and then somewhere in there had another close contact, a different close contact. So they kept telling us to wait a few days and then get the test. And then they kept coming back negative and then to wait a few more days and do your final test. Anyway, so we had some sense of, I guess a few questions came out of it. Number one, we had this terror that we were, using more tests than should be used, that there's, some difficulties there. But the other thing was we got him boosted and we were worried about what are the tests, which tests are going to read a false positive could read a false positive from a booster shot versus which one is going to be, is going to be pretty, isn't going to give you a false positive from a booster. Does that make sense?
Yeah, that's a really good question. So the booster or either vaccine will not cause you to have a positive test at all. Okay, so that is teaching your body, your immune responses to develop that spike protein that can fight the virus. So you're actually considered fully boosted as soon as you get that shot, as Dr. Nate says, as soon as the needle comes out of your arm, but it will not affect a test at all. So I'm sorry your child's been getting exposed so much. That's a bummer, but I know that there's quite a good quantity in Juneau of the over-the-counter tests available for taking home, correct?
Well, no. I mean, I think the library was giving them out and they ran out. So I'm not sure if you're referring to the school district or just in the
Yeah, the school
community.
district I was thinking of.
Oh, yeah. So a lot of this was over the break, and
Oh,
and I
okay.
don't know. I don't want to spread misinformation, but just our personal experiences when we tried to get some for home, the libraries had already run out.
Okay.
So yeah,
Okay,
that
got
could
it.
have that was a week or two ago, so that could have remedied. Don't let me give
Okay.
misinformation.
Well,
Okay.
my understanding is in the district there that if you're a close contact and you are your child's in the school, that there's still tests available for that they'll give out. So
Great.
yeah.
Thanks.
Yeah. Good question though. Really good question. Anybody else?
Barb, yeah, there's a question about if you or a child or a student has a COVID, how long should they wait to get boosted?
That's a really good question. Usually, the healthcare providers say wait until you're out of isolation, your fever's been gone, your symptoms have decreased. So usually a minimum of 10 days. So yeah, I would probably wait myself just a little bit longer than that. But yeah, it's really awesome protection. You've actually had COVID and then you get boosted. It's probably one of the best protections, both your natural immunity and the immunity from the vaccine. Not that you want to get COVID, but right.
Great. Well, thank you so much, Barb, again. Did you see another message just came in from Cheryl with Rally Down in Juneau? How long do you have to isolate after the fever has been gone?
24 hours. So you want to make sure that you haven't been taking Tylenol or ibuprofen. It's actually a lot of the pediatricians recommend not using any of the fever reducing until for your children until the temp gets over 102 so that your body can fight that fever themselves. But yes, you want to wait 24 hours. Okay. So say you had a fever on day 5, you could have got out of quarantine. It continues to day 6. And then 24 hours after the fever goes down, then you can go back. You can enter quarantine.
Awesome. Thank you so much, Barb, for sharing. We will make sure to share the slides and this recording out with folks who weren't able to attend. And for any of you who might have been trying to jot down a lot of notes, we'll make sure again to send those out after today's meeting. Thank you, Barb.
You're welcome. And then make sure to refer to that CDC chart that was pulled up for the isolation and quarantine. You can make copies of that too and have that so you can refer to that, because sometimes you have to go through it a couple times to remember it. So well, you're welcome, Thomas. It's great to see you again and see everybody. And thank you for helping all our kids. I love after school programs. So amazing.